Good afternoon, everybody, and thank you for coming to our December Lunch and Learn, our year-end Lunch and Learn. Just so you know, our next one will be January 10th, of course, the second Friday of the month, 12:30 to 2, Norman, and here. And we are having Kirsten Hotchkiss talking about employee law. This Lunch and Learn will only be available to owners, so you may not bring any employees to this one, because what she's going to be pointing out are all the things that you guys are probably doing wrong, and we don't want the employees in the room to take advantage of that information. Fair enough? But you can bring guests that are owners. And today we have Diane Goldman speaking about the Affordable Health Care Act, and we'll get to her in a second. But I thought it was interesting that 6 months ago when we were making this calendar, who knew it would be the hot topic that it is today? And it just kind of worked out well.
I'm Diane Goldman with New Agency Partners, and thank you all for coming here today. So I assume that you're here for one of a couple of reasons. Either you've been in a deep coma and you just woke up and you've heard about this thing they called Obamacare and you got to hear more about it. Or you've gone to maybe one or two seminars and you're totally confused and you're thinking if you go to just one more, you might learn enough to really get it. Or you've gone to 3, 5, I know some people that just keep going to these presentations and over, and I call you guys, you're just Obamacare junkies. You'll never know enough. I'll do my best to have you learn something new. Or it's Friday, it's the middle of December, and you've got a free lunch. You never turn down a free lunch. So whatever the reason, I appreciate that you're here. There's a significant amount of information, provisions, et cetera, that relate to the code. What I've tried to do is sort through them and put together a presentation that is somewhat relevant to the group and timely in its matter. So I hope that that's the case. I know you don't want to hear me talk in my monotone voice for the next hour. So please, if you have questions, don't hesitate to ask them about specifically what I'm talking about. If they're about something other than what I'm talking about, maybe you can hold them. I might very well address them later in the presentation. And of course, at the end, I'll handle any questions that you might have. So what is healthcare reform? We've heard a lot about it. It really is the biggest overhaul to our healthcare system since 1965 when Medicare and Medicaid was introduced. So it is a significant change. We've all seen probably the piles of paper that compensate the law. And it is going to have a significant impact. Consequences may be intended or unintended. So let's see. I thought a good way to look at this was to take a look at the goals and objectives of the reform. Okay, we've all heard about all the different provisions. We might know them singularly, but we might not realize that they're all in here for a reason. They were all in here to help achieve a couple of goals and objectives. So the goals and objectives of healthcare reform were to increase the quality and affordability of health insurance. Now, I know a lot of you are going to raise your hands and go, well, affordability, that's not happening. But we're going to address that further along in the conversation. Lower the uninsured rate, okay? Reduce the cost of healthcare both to the consumer and to society, and improve healthcare quality. Now, if we take a look at all of these goals and objectives, you might realize if you start to think about it, they are all intertwined and interconnected. Let's think about lowering the uninsured rate. The uninsured in this country are unemployed, low income, and typically young. So what do we have to do to get them insured? We have to make it more affordable. So that goes to item one. If we improve the quality of healthcare, we're going to improve the overall health of our system. And what that will do is go to item 3, reduce the cost of healthcare in the system. If we look at the quality, improving the quality of health insurance via the health insurance mandates, which we're going to get to, but all these mandates as to what policies need to look like. If we do that, more and more people are going to exercise their rights for preventive care. If they actually go use the preventive care that's provided at no cost, it will improve their overall health. Improving the overall health of all the consumers in the marketplace will ultimately result in the lower costs of health care in society. So although maybe the provisions on their own don't seem to make sense. If you look at them combined and together, you can see that they do work to achieve what I'd say is really overall health and therefore an overall reduction in the cost of healthcare in the system. I think it's really a matter of time as we try to see it filter through the system. So the first objective, affordability and quality of health insurance. Affordability, they enacted several provisions, and what I wanted to do here is take the individual provisions that we've all heard about them and put them into the model and take a look at how they fit into the goals and objectives, and maybe they could make a little bit more sense. Affordability, we've added the individual subsidies. So again, for those that are in low income or unemployed that are having trouble buying health insurance, the government has added the individual subsidy provision. The small business healthcare tax credit. The purpose of this was to encourage small businesses to provide healthcare to their employees. I think it's still the government's intent, and as we look at this a little deeper, that businesses be the primary access point for healthcare. I think they still want it to be that way. It's a much more fluid way of employees accessing and getting healthcare, and it's a complicated process. The last look at affordability is limiting the amount that insurance companies can pay for overhead. In other words, they must pay 80% of the premiums that they collect for medical care. So by putting a limit on how much they can spend in overhead, again, they're trying to get more back into the system, lower the cost of insurance by lowering the costs that health providers assume. Now we'll go to quality of health insurance, and this is where the the insurance mandates come in. We've all heard about a variety of mandates. All plans must have essential health benefits. All plans must cover preventive costs at no cost share. No pre-existing conditions. So anybody can access health care. You're not going to be excluded if you had a previous illness or other kind of condition prior. Getting clinical trials covered. Allowing children up to the age of 26 to continue on their parents' plans such that they don't have trouble in the marketplace buying individual coverage. Expanded women's preventative service. So all these mandates, which are designed to tell insurance carriers what provisions have to be in the plan, improve the quality of the health insurance contract.